start another very important topic, which is very important for in our field. Let's start with Bismillahirrahmanirrahim. So basically, it is actually ulceration. Oral ulceration is basically a very painful oral ulceration that occurs at intervals. Means it comes and go, ranging from days to months, even years. The most common lesion of oral mucosa, it is actually with the 50 to 30% and affecting more females than males. It appears at any age, mostly to the middle age or the young to middle second to third decade of life. It can be also familiar occurrence, means genetically, which is 30 to 40% patient. Okay, so basically it is a painful ulceration at an intervals ranging from months to days. Okay, basically now what are the principal causes of oral ulceration? Very important. So basically, number one is trauma. Either it can be cheek biting or sharp tooth or ill-fitted dentures. Then basically recurrent epistomatitis, means the minor major herpetiform ulcers. Then you have infections like HIV, TB, mucocutaneous diseases like lichen planus, pemphigus, systematic disorders. You have actually Crohn's disease, Paget disease, anemia, squamous cell carcinoma, basically non-healing ulcer, and drug is basically you have non-steroidal anti-inflammatory drugs or chemotherapy. Patient can also have this. So basically it can be genetic factors, actually in family history, infections like HIV or viral. Then we have actually exaggerated response to trauma also, either due to lead biting again. Then immunological abnormalities can also be the cause, like autoimmune involvement. Then we have stress, actually hormonal disturbance can also be like menstrual cycle. Then hematological deficiencies, patient has actually deficiencies of many things. In GIT disorders we have actually Crohn's disease, celiac disease, ulcerative colitis. You can learn this basically by with the mnemonic like give. Okay, give for genetic predisposition, I for infection, and V for actually V can you remember by deficiencies, vitamin hematological deficiencies. Then E for exaggerated response to trauma. Okay, and his means H for hormones, I for immunological, S for stress, H is H for hematological deficiencies. Okay, and G for GIT. Okay, now basically we have talked about that oral ulceration is basically a very painful ulceration. Okay, that can actually an interval with a wide range for months, from days to months and years. Now RAS is basically is idiopathic, is unknown. Accumulation of data according to the concept, the path of physiology of recurrent aptis ulceration is immunologically mediated. Basically what happened is actually dysregulation of the cells of the mediated response. Clinical features: